Thank you, Dr. Gust Bardy, for joining us today. Dr. Bardy is Professor of Medicine and retired from the University of Washington. And thank you for agreeing to speak with us to help the millions of arrhythmia patients around the world. Welcome.
Thank you. Pleasure to be here.
So a lot of people will have a 12-lead EKG, but it doesn't pick up any symptoms, obviously, because it's so short. A lot of people will have intermittent symptoms, and it's really difficult, whether it's somebody with a history of fainting due to cardiac problems, whether it's atrial fibrillation, lots of reasons for not permanently in an arrhythmia. So tell us about other devices that may be approved for longer than 12 seconds.
So let's go back to your question about fainting or feeling faint. There are many manifestations of arrhythmias. Fainting can or cannot be due to an arrhythmia. Feeling your heart race may or may not be due to an arrhythmia. There are other more serious problems that can be related to an arrhythmia. A cardiac arrest, for example, can be due to two very serious arrhythmias, extremely slow heart rates or extremely fast heart rates. Stroke, for example, can also be due to an arrhythmia. Typically, that arrhythmia is atrial fibrillation, which is a quivering of the upper chambers of the heart where they don't squeeze in a regular manner, and they are prone to clot formation inside the lining of the atria. That is another serious problem. Again, I don't want to speak to fear or to over concern, but that's on the serious spectrum and one that we should be concerned about, again, as we age, or if we have other underlying problems. The types of monitors that are out there range from simple things like watches and little portable monitors that you can apply at the time of your symptoms to more medical grade products that are designed to continuously monitor your heart rate over long periods of time. So here's an important fact for people to recognize. If you have a serious problem, often you are unaware of it. Whereas the opposite is also true. If you feel your heart racing, often it's for a normal heartbeat. So it's a bit contradictory. If you buy one of these devices to check when you feel your heart racing, it's a self-defeating purpose. Some people are very good at it. They have real heart rate problems, real arrhythmias, and they know when they occur. But that's the minority, the very small percentage of the population. Most people that feel their heart race have a normal rhythm. That doesn't mean that they don't have an arrhythmia, which they don't feel. So it's a bit of a paradox. My recommendation for my patients is to get a continuous monitor, whether they feel it or not. Because here's another principle to keep in mind. People with real arrhythmias, at least half of them have two different types. It's not one thing. So some have 3 or 4 different types, and that changes the way you are managed and diagnosed. So you can't just press a watch button and get a simple response or put on some sort of pocket device. They don't really satisfy the serious concerns of picking up serious arrhythmias over long periods of time. So we would recommend a continuous monitor for a minimum of 5 days, and 14 days is a reasonable duration if you if your skin can tolerate it. So having every heartbeat recorded over that period of time is very important to picking up these. The term is asymptomatic. That means you are unaware of them because they last briefly, but they are important to know that they're present. They change the way your physician manages you.